Hi, everybody. My name is Sam Coffman, and I am here to talk about wound care and infection management, primarily using herbs, but also just the whole concept of what and how can we work with wounds. And a lot of it is first aid type stuff that is fairly practical and common sense. You know, the pragmatic aspects around just wound care in general, but also, of course, how can we use herbs, botanicals, to be able to increase our tissue healing time, to be able to move us through the different stages of wound healing that we're going to talk about. Let's take a look at all the different stuff that we have in our own, in some sort of a first aid kit that we would use for something like wound healing. And look at how we could pack this up. We could literally, in a first aid kit, we can literally have everything sitting in a Ziploc bag like this. So we use these, kind of thicker Ziploc bags that we use for our first aid kits that we sell at our, through our store. But what are some of the things? So all of the stuff that's in here between what we just talked about, with the steri strips, with our tincture of benzoin. We want to have some sort of bandage or dressing rather in here. So we want to have 2x2s, 3x3s. You can have 4x4s in there. We want to have some just regular old Band-Aids. So we do that, and then we move to, further functional damage. So here's another picture here. So I think this is maybe the last of all of the pictures that might be, a little bit medically intense, I suppose, for some folks. This is actually one of my students who he just wouldn't listen to me, and I had to teach him a lesson. No, just kidding. He was one of my students, but he cut himself with a very, very small nick on the back of his hand. Really, it wasn't that deep. He had a brand new knife, and he was working in. We teach survival classes, and he was doing a friction fire. He's doing a bow drill fire, and he cut himself on the back of his hand, right about in here somewhere, as you can see, and he just nicked that extensor tendon there that you see. You can see the two ends. Okay, let's talk about inflammation. Acute inflammation is a little different than chronic inflammation, and acute inflammation from trauma is a little different than acute inflammation caused from other sources, etiologies other than trauma. But in general, I know this isn't the best picture in the world, drawing in the world, but basically we have our blood flow flowing through our capillary beds, from our arteries, of course, from our heart to our arteries to our arterioles, into capillary beds, and then back out through the venules. A couple more herbs I want to talk about here at the very end is just yucca root. This is a local yucca rupicola, which is a twist leaf yucca, and then some algarita root. It's our berberis trifoliata. This is the one that I mentioned, I think, earlier in the lecture as well. So you notice that yellow look there. That is our berberine in there, which is an alkaloid that we find in all of our Berberidaceae family normally, in our Mahonia, in our golden seal as well, and our Coptis chinensis. This alkaloid has been really famous for a lot of different things throughout the last several decades.